I'm the director of the research program on children in diversity here at the Boston College School of Social Work. And I'm the principal investigator of Youth Forward, which is a U19 scale-up hub funded by the National Institutes of Mental Health. And our seminar, which is the Grants and Sponsored Research Initiative, or GRIT seminar, is dedicated to advancing methods and skills in implementation science. And we're co-sponsored along with two other hubs, the Essence and the Spirit Hub within the U19 Global Mental Health Network. And we are really honored today to have Dr. Ross Brownson, who literally wrote the book on implementation science, as a speaker today. So for those of you tuning in, this is a real treat and an honor. Ross Brownson is a professor of public health at Washington University in St. Louis. He studies the translation of evidence to public health practice and policy with a content focus on environmental and policy determinants of chronic diseases. He's the author of 15 books and over 500 peer-reviewed articles. He has received numerous awards for his work. Among these, he's the recipient of the Charles Shepard Science Award, the highest award for science from the Centers for Disease Control and Prevention. And he's a former president of the American College of Epidemiology. So it's a tremendous honor to have you here today, Ross, and to have you help our junior faculty and trainees in thinking about writing grants and especially crafting an aims page and the key ingredients for successful proposal writing. So I'm going to turn it over to you, and thank you again for being here.
Sure. Thanks, Teresa. You're hearing me okay?
Yeah, great.
Okay, great. Well, I'm glad to be joining everyone. I wish we were all together in the same room together so I could see the whites of your eyes, but this will be the next closest thing. I'm glad to present this sort of, getting your project funded comes in many different forms. I'm getting some feedback, so if anyone's out there, they might mute their phone and that might help with the feedback. Okay, let me keep going. So what I'm going to do is orient this the way one would write an NIH grant, sort of our big federal agency for funding of health, but it really applies to any grant. A grant is telling a story, I'm going to tell my own story here about writing aims, and so it's sort of a story within a story, I guess. And I'll talk about some of the basics, sort of why it matters, a formula that we tend to use, and I'll just put a caveat in there because there's not really a magic formula. Teresa and I were just talking before the call, and every grant is a little different. How you write the aims for a really large 5-year, multi-million-dollar project is going to look a little different than it is for a $5,000 pilot study that will take 6 months to a year to complete. So keep that in mind, that there's not a one-size-fits-all, but there are some commonalities and some things that seem to be successful. That's the formula. Then we'll have a few examples of aims pages from funded grants, and there are many more out there, and I'll give you a portal, at least in the implementation science world, where you can go find lots of grants and look at them. Because one of the best ways to see what's out there, and more this is available, is to look at other grants that have been funded that might be somewhat similar to what the kind of work you're doing, because I know each of you is doing work that is similar but also different. And then we'll talk about a few other parts of grant writing, and then we'll open up for questions. So here we go. So this is the magic graph, and in the NIH world, this is sort of on the far right. When you get a grant submitted, as a lot of you know, you end up getting a score from 10 to 90, where 10 is the perfect score and 90 is the worst score, and that's the overall impact on the right. The components that go into that, the approach, the significance, the innovation, the investigator, and the environment. What this shows is it's a regression analysis that looks at which of the other subcomponents of a grant based on, I think this is based on 30 or 40,000 grants funded by, or reviewed by NIH. It's which of the other subparts of a grant predict the overall impact. So these are sort of, the blues are sort of predictors of the right, and the right is what gets you funded. And so these are the pieces of your story. And so obviously the approach is the methods of your grant. That's got the biggest weight by quite a bit. And then you can see how other things come in. And so one of the things that says is in a grant, you want to really do well on all parts, but especially on approach and significance and innovation. And approach is the one where there's probably the most amount of flexibility in sort of what methods people use and how they're done well. And so the aims page is the entry point to telling the story. And so in some ways, the aims page, in fact, the aims page is the part of the grant that I always spend the most time on, and sort of write it, draft it, let other people look at it, rewrite it, redraft it, and go through a number of versions. And I continue to update it as I'm writing the rest of the grant. So that's just how I do it, and I think that's a good way to think about it. Well, so to the essence. You know, we like to get to the essence, the sort of short version, the elevator speech. I really believe, so, you know, the reviewers typically are reading a lot of grants. We'll talk a little bit more about the context for reviews in a minute. But I really do believe, having been on many reviews, I chaired the implementation science study section at NIH for a number of years. And so, you know, I've seen a lot of grants go through review. And I really believe that these busy reviewers sort of, it's sort of like you're reading a newspaper article and you read the first line, you read the title first, and then you read the first paragraph. And then what do? You decide if you want to read the rest of the story. That's really what the aims does. It's sort of like the first paragraph of a newspaper story, and it's telling you whether you're going to read the rest. And really, I think there's a confirmation bias that happens with the aims page, where if a reviewer sees your aims page, it's well done, it kind of hooks them, they read the rest of the application with a different look. If they read it and it's kind of boring, it's hard to understand, it doesn't get at anything that's really innovative, what we call the sizzle, sorry for the vegetarians among you, it doesn't hook them, then they're going to read the rest of the grant with more skepticism and sort of be looking, so are they looking for strengths or weaknesses when they read the rest of the grant? When you get trained to review grants, what the review leaders, called the CSR, the Center for Scientific Review, at least at NIH, they coach you to say every grant starts in the middle. So every grant starts at a 5, and then you're reading it, and you're either going to go down toward a 1 or you're going to go down toward up toward a 9, and you want it to go down toward a 1. And so what are you doing on the aims page? You're going to tell about the problem. You're going to try to hook them. What's the sizzle? What's the unique contribution? What is it on this page that will jump out at them, that will let them know that this is an important public health, medical care issue, social service issue, and you're telling that story usually with 2 to 4 aims. In a way, you know, this is a little bit simplified, but in the way that your grandmother would understand it. And by that we mean, keep in mind, you all work in some special area in health and health-related research and practice. And you understand all your terminology, the problem very well. Reviewers could be from any different field. They may know very little about the content area you're doing. So you want to say it in a way that's understandable, kind of pitch it to a mid-level audience, tell a little bit about the story, about why you're doing the project, what's it about, have it a logical order that they follow. And I have a rule that no aim should be more than 2 lines. I see some aims that are sometimes just long, complicated, run-on sentence that might be 4 or 5 lines, and those tend to put reviewers to sleep. So that's one thing to think about. And then the stake, so the sizzle is grabbing people. The stake is, okay, now I'm sitting down to do the meal. What does the meal look like? And so how will you accomplish the aims in broad strokes? And the broad strokes will then be told in full volume in the rest of your application. And then I usually put at the bottom of the aims page implications. I usually sort of return back to the NIH criteria and say, this study is, we have an excellent environment for this study because of X. It's innovative because of X, and its impact will be the following. And I always have that word impact in, because that's what reviewers are finally scoring you on, is the potential impact of your project, okay? how's the world going to be a better place if you accomplish what you're going to accomplish in the little story that you've laid out on your aims page. So here's a formula. Might not be the perfect formula, but the one that we use. So start off with just a few sentences about the problem, any of the technical definitions of it. Start off broad, cancer is killing this many people every year, and the healthcare costs are X. And then you're narrowing down into a certain kind of cancer, and then a certain problem in controlling that kind of cancer. At least it's kind of in the world where I work, where a lot of the work is cancer related. And then if it's a bigger grant, you might have a paragraph on how your pilot work or preliminary studies have set you up to answer the questions that are laid out below in the aims. If it's a small grant, you may not have that. You may have a little bit more about what the problem is, maybe what some of the gaps in the literature or in practice are. But if you're writing like an R01 scale grant, a multi-year large grant, you always want to let people know that your preliminary or pilot studies are setting this up. I look at this as the idea that reviewers tend to be risk averse. They tend to be skeptics. They're researchers, and so they look at things with a very skeptical eye. And so the more pilot work, preliminary data, we've developed the measures. We have ability to recruit the populations. We've done a small pilot study to say that we can randomize if you're doing randomized studies. Think of all the things that a reviewer might hone in on as a weakness and answer those as a preliminary study. And the very easy summary of that, quick summary of that is shown even on the aims page. And then the setup, the third bullet, some people call this the goal. The goal or the big picture thing we're trying to accomplish is X. I probably would not use the word aim there because it might confuse later with specific aim, which is the NIH language, obviously. And then 2 to 4 short aims. I don't write very many grants now with 4 aims unless it's a really large, complicated grant. Even on a big grant, I try to limit it to 2 or 3, but there might be a 4th if you say have a final dissemination aim or something like that. And then sometimes right below each aim, sometimes as a paragraph, we'll accomplish these aims using the following study design by the following set of activities. And then this final one that I mentioned before, the so what, who cares? What's this going to do? And you always want to, one of the starting points for writing a really good grant is read the funding announcement really well and study it. Use some of the language that's in there. Be sure that you're very responsive to it. Okay. So I've got 4 kind of broad areas that are sort of the context, the background, the overarching things to think about when you're writing a grant, and in this particular way, in writing the aims page. The first part is the context. Reviewers are people like you. They're people who are doing this on sort of their spare time. It's often not built into our regular work week, so keep in mind they get quite a large number of applications to review, often anywhere between 6 and 10 applications to review, so you get an idea of the volume because these things are not short and simple to understand. They might be doing it on nights and weekends. They might be splitting it in between other work that's going on. They might be doing it on airplane trips. And so that's important to keep in mind. If your application starts out to be hard to understand, poorly written, doesn't hook them, doesn't seem all that interesting, that's a problem. And I already hit on that. What you're doing with the aims page is trying to get people to read on. I see that. This is really interesting. Now I'm going to learn about the rest of the story and the rest of the grant. I kind of hit on this other one about the audience already, but the reviewers, often in a typical study section, you'll have 1 or maybe 2 reviewers who very deeply know the content area you're covering, and the rest might be, an anthropologist, an oncologist, a social work researcher. There might be a whole range of different disciplines there. So keep in mind that you're going to have to explain some things, especially if you're working in a really technical area. And the way you write there is don't belabor obvious things, but explain things that are from your discipline that may not be known across many other disciplines. Work in plain language. I've read some grants that bridge into genetics or even economics where there's a lot of technical language, and sometimes not on the Ames page, but usually on the early in the grant itself, usually on the first or second page of the main text, people give a little definitions block over kind of on the upper right-hand side that say, here are 5 common terms we'll refer to throughout the application, almost like a little cheat sheet that reviewers can fold back to. Just as another note about how reviews happen is sort of the one above. When I started out doing this years ago, a few decades ago now, everything was done by mail. So when you wrote a grant, I think it was 8 copies, you would make 8 copies of it, you would mail it to the funding agency. Now, of course, most everything is done by electronic version where you submit it online. But keep in mind that some reviewers will print out a hard copy of the application and some will do everything online. And so that's important to keep in mind when you write it, when you make it easy to refer back and forth. Kind of think about that, how that review happens. I would say the majority of people now do almost everything online, but I come to study section still, and someone will bring their wheelbarrow full of grant applications for people that they've been reading because they really like to have something they can mark up and refer back and forth. So keep that in mind as well. So the aesthetics. When you look at it's almost sort of like looking at a good website. When you look at a good website or a good news feed that you like to read, is it dense, boring, hard to understand, lots of jargon, single-space text that's just uninviting? Or is it more of a journalist style with smaller chunks of text separated by space, especially when you get to the main part? Are there figures and tables that break up the text? On the Ames page, it's more, smaller bits of text, maybe bullets, maybe ways of dividing up the Ames. So keep that in mind. In a few minutes, I'll give you a few examples that will walk you through those. Some of the examples that are really good, I think, and some that are not so good. And then the organization is more or less what I talked about earlier. The structure, the order. I tend to think of reviewers as dumb animals. I think that you want to think of them as, okay, I've got 3 aims. When you get to the main part of your approach, your method section, here's what we're going to do to accomplish aim 1. Here's what we'll do to accomplish aim 2. And here's what we need to do to accomplish aim 3. And so keep it very logical. And that logic is set up on your aims page. If your aim 2 is dependent on aim 1, you want to state that. If you always want to keep in mind too, if the aims build on each other. So let's say what happens in aim 2 is totally dependent on something that happens in aim 1 that is sort of high risk data collection. That can be tricky because what if aim 1 doesn't work out the way you thought? Then you've got a whole aim in the form of aim 2 that you really can't accomplish in the same way. So think about that flow and think about the ramifications. If you're doing mixed method sort of work, where you've got a quantitative and a qualitative part, and you're mixing, blending, merging the data together, you want to tell a little bit of that story on the aims page as well, okay? So this comes up a lot. Should I include hypotheses? I'm an epidemiologist in my way back life, and epidemiologists say, well, that depends. It depends on your study group. It depends on whether your data hypotheses are usually quantitative. So are you studying something quantitative? Is it a bigger grant or a smaller grant? Do you have enough data to be able to generate a meaningful hypothesis? My general answer to this is on bigger grants, you probably want to have at least one hypothesis. You also, if you have 3 aims, you might have one aim that's more of a developmental aim where you're going to refine a set of measures. You don't really need a hypothesis for that. But then you might have an aim that is testing implementation strategies in a certain setting. And there's a directionality to it. And there's a hypothesis that you might say that says, you know, when we use this tailored method for training, we expect the rate of X to go up or down. That then is more amenable to a hypothesis. So I think that's important to keep in mind. I've seen times when people just sort of throw in a hypothesis and it's hard to, in fact, I reviewed a grant like this the other day from a colleague here who wrote hypotheses for things that were not really quantitative where there was any directionality. It was sort of like you accomplish it or you don't. And that's not really what people often look for as a hypothesis. You know, we're all going to have our own preferences as a reviewer. Look at other grants. Think about any biases people might have going in. Address things that are important and meaningful, and make sure your hypothesis is tied with the overall impact. So if this hypothesis tends to play out in this way or another way, how does it affect the overall usefulness and impact of the project that you're doing? And there are funding agencies who will require you to form hypotheses or research questions. And so you want to always keep that in mind. And that goes back to what I said earlier, which is one of the key factors is read the grant application carefully. I'm sorry, read the funding announcement carefully. Okay, so now what I want to do is, so from colleagues and getting permission from a few other groups, these are all sort of related in the implementation science world, and they cover a number of different topics. And I'm going to kind of walk through each one, and I'm going to kind of highlight a little bit about each one that I liked and that I also liked less. And all the Ames pages I'm showing here have been funded. So, you know, I think some of them violate what I said later about having a lot of dense text, for example. That one, that's a lot of dense text. Now, the sentences are pretty short, and so it sort of looks like a lot of text. If I was doing this one, I would break it up a little differently. But what I like about this one is it starts out in this big study, challenging environment. The U.S. healthcare is ripe for change. And you look at that third paragraph, this is their pilot work. Our 14-year line of investigation has done X, Y, and Z. This is a study Kurt Stange did, who does a lot of work in primary care and implementation science. And so you can see they kind of set it up. They come on, and then they talk about this laboratory of innovators. That's sort of catchy. And then they in this study, they had 4 aims to it. Also, if you see that first word of each aim, discover, identify, analyze, foster, use sort of an active verb there. And there's better or worse active verbs, but that's important to keep in mind. And you notice that Kurt in this one, he used a different one each time, and they sort of grab you. And then if you look on down at the bottom, this is kind of the so what. Has a great potential to discover and inform subsequent evaluation in healthcare, innovation, transportable. And so this is one that is sort of goes from big to small. He doesn't do a lot of the roadmap here about exactly what they're doing. They talk about case studies. He has a bit in here about what they're going to do with some of their work as well. So that's an important one to keep in mind. Here's another sort of a dense one. I would definitely say this one on that very first paragraph, that's a long paragraph with a lot of text. And I'll give you kind of the counter to that one in a few minutes about one from a colleague here, Matt Kruder, who's really good at, he's a health communication expert. And they sort of walk through this one. This is a study coming out of Peru. They line out in here some of the preliminary data. They have a large bit up here around the setup of the study. So this big paragraph at the top is really kind of setting up the study. It's sort of significant. It's sort of building that. Little things in here. You can see in this first paragraph, they do call out for the last name of the author when they're citing references. I tend to use JAMA formatted references with superscripts and not call out the name of each author because it takes up a lot of space, and I think it's a lot cleaner look to have superscripted sort of JAMA style referencing, but that's probably a personal preference. And then here's one on tuberculosis. And see, this was a little different. They put their goal statement at the top. So they put the big picture thing they want to accomplish at the top, and then they sort of work through the formula. The third paragraph gets to sort of what they're going to do, how they're going to do it. This one doesn't have a ton of their own preliminary data, but it gives you some good examples. And then this one's interesting. They have 3 aims, and then the A, B, C, D, for example, under aim 1, that's really the activity that's going to accomplish that. So one part this reminds me of is what I often see people doing is conflating the scientific aim with the activities, like, conduct an evaluation of X. That's really more of an activity than a scientific aim. So the aim wants to be the scientific thing you want to accomplish. The activity is what you'll do to accomplish that aim. And so always try to keep that in mind. There's obviously overlap between those two definitions, but conflating them too much doesn't work. And I don't tend to start aims with the word to. I tend to start with a more active verb like develop, test, evaluate, discover, identify, things like that, words like that are going to be more active words than to. And I think this one, you can see all the way down, they're using the word to like a lot of times. And I think that can get a little redundant as well. This is a colorectal cancer study. This is a smaller grant. This is one of Brian Weiner's grants where they're studying colorectal cancer in community health centers. So this is interesting because even in a smaller grant, Brian has 3 aims. In R21, as you probably know, is a 2-year grant with a few $100,000 budget. So it's a decent sized grant, but it's 2 years. And so any of the smaller grants I've been involved with, I try to limit it to 2 aims. But obviously Brian was successful at this and was able to get this funded. I like this one. There's a couple things about this one that I think are useful. One is if you look in that second paragraph, I like to do that on the aims page is sort of underline and italicize the key phrases. So as you go through, it's easy for the reviewer to kind of hone in on the key parts of each of those paragraphs. And he's got, nice scientific assess, estimate, and then sometimes if the space permits, so if you look at A1 here, assess the extent. The paragraph that follows that aim 1, those are really activities. So when I have space, what I tend to do is say right below aim 1 and say to accomplish aim 1, we will, and then put 2 or 3 things in bullet pointed statements that will do it. Now, obviously that takes up a little more space, but it's a nice way for people to break up the text and also to see very clearly what are the 2 or 3 activities that are being accomplished to carry out each of the important scientific aims. And then you see in the last paragraph here, this is the kind of thing I like to see. The study is innovative because here are the expected outcomes. I would end with something like, and the impact will be this, or this is impactful because of X. But that kind of wrap up paragraph at the bottom of the aims page, I think is a nice way to kind of circle back to the so what of the whole thing. Here's another one, and here's an example where they did hypotheses. So there's a total of 6 hypotheses nested within these 3 aims. And so here I generally like the layout of this page, but for me, these aims are too long. There's a lot of words there in aim 1, that's 4 lines worth of text. A little bit hard to follow, and even the hypotheses. So I would probably sort of scale this one back a little, but I think the points above, the significance, what it is, why there's a gap in the literature, why we're doing this trial, those sort of lay out pretty well. But I think I generally would not try to put 6 hypotheses in on an Ames page, I usually would have at most 2 hypotheses for a single specific aim, but that's probably a personal preferences. So like on this one on the third aim, they have three stated hypotheses. If you could do it, kind of line out the most important hypothesis that you're testing, and then you can always lay out additional analytic strategies later in the main part of your grant. Okay. Here's a VA grant from Ann Sales, who does a lot of work in the VA. And this one's a little bit dense, but it's another example, kind of laying out what the big pictures are, what some of the work they've done. They're called the conversations that they've had in these community living centers. That's sort of the pilot work. They've got this handbook, what they want to do with it, and then the aim. So that's going down below. This is an R21 of mine. That's a project of a 4-country study on evidence-based cancer control. And looking back at this, it's a little bit text dense. This one, we kind of put so if you look at the third paragraph here, the significant, extensive knowledge, and then the impact, I typically now would put that at the bottom of the page, but that's not a big deal. That fourth paragraph says, here's what we're going to do. And then we've got an aim, a rationale, and then instead of hypotheses, so you can see in this one, it's an R21 grant, so it's a 2-year grant. We put in here 2 aims. And instead of, and this wasn't really a hypothesis-driven grant, it was really exploratory in many ways because there was very little data available at the beginning from Brazil and China. This is a study we did in US, Australia, Brazil, and China. And so we decided to just post research questions instead of aims. And so that's another way to go if you're in more of a developmental area, okay? This is an R01 grant. And so you can see in this one, we mixed the questions, so research questions, with hypotheses. So in areas where we were really doing something quantitative in aim 2, we included hypotheses. In other areas, we included research questions. So that's another one. This is a complicated study because it's got 3 phases. So we decided it was important to begin in the, even on the Ames page, to lay out the 3 phases of the study and how one builds on the next one. And this is successful. This is a study we just finished up that just finished end of last year. And then I think this is the last. Well, nope, one more after this. So here's a couple more. These are 2 Ames pages from Matt Kruder, who works here at Washington University. He's an expert in chronic disease prevention in underserved communities and in health communication research. And I like, this one is probably, like his Ames pages tend to be the most aesthetically pleasing. If you look at this one, this is a tailored communication cancer navigator grant. And this is a study of smoking cessation in low-income smokers that was done through the Missouri Quit Line, I think. And you can see how he lays them out. Look at just the aims here, how easy they are to understand, the research questions. And then the bottom wrap up, the so what, about what's innovative about it. So I really like the look of it. You can see he's built it so that there's some breaks in between the paragraphs, so it's sort of easy to understand. And he put a little box around the sort of significance, like why are we doing the study in the first place? And then another one is another one of Matt's, and this is a study in 211, which you don't know 211, it's kind of like 911 in the US, where if you have an emergency, well, 211 is if you have a social service emergency. You know, I can't pay my heating bill this month. That's the idea of 211, so it's a call-in service, and they've done a lot of work in that setting to try to reach people calling 211 on health-related issues, because obviously it's a very high-risk population. And so you can see here, they've got their main aims underlined, starts with estimate, evaluate, and then they've got a dissemination aim, which is often nice to have, especially in implementation science grant. What are you going to do with the results? And so this one, I believe this is an R01 grant. So this is a pretty large scale grant, and they did include hypotheses on this one under AIM 2. So there's some examples. I'm going to give you a portal in a minute that will show you a bunch of other grants that you could look at. Okay, so kind of getting to the end here, and then we're going to have plenty of time for Q&A. And some of these things I've already said. And so these get to just a couple of overarching issues that get to the full story of your grant that really starts with your AIMS page. So one other thing I will say is, besides the AIMS page, the other part that reviewers tend to read early and often is the summary or the abstract. And so you want to have that tell the story very well. A lot of that's going to overlap with the story you're telling on the AIMS page. But those are the two parts that sort of are the entry points for reviewers and whether they're going to like your project or not. Read the funding announcement. I've already said, generally, smaller grants are easier to get funded. That's generally true. It's not always true. And if you're starting out, start small. Write a pilot grant in your own institution. Write a pilot grant to any funder internationally or in the U.S. Think like a reviewer. Like I talked about that as a contextual issue earlier. People who are busy, they're quick, they might be irritated, they might be, sleep deprived when they're doing this. They might be novice to D&I research, and especially a novice to your content area. Match your grant type to your project aims. I've sort of hit that already. A big grant that's quantitative can definitely have hypotheses. A small exploratory grant probably doesn't. This bullet is important. If you haven't, when you're getting ready with an idea, talk to the program officer in the agency where the grant's going to be funded. That is often very helpful. It's helpful in a number of different ways. One way is that, at least at the NIH, program officers are all scientists themselves. So they're all going to be MDs or PhDs or people with advanced training in research. So they can help you on laying out the research itself, okay? They can also help you about navigating the system, especially if you're new to this. There's so much that happens with one of these grants and so many different steps, and it gets referred different places. So they can help you in answering any questions about sort of how the process works. And then the third part, which I think is in many ways is the most important part, if your grant ends up, let's say on the bubble for the pay line, let's say that you're sending a grant to the mental health arm of the NIH, and their pay line is at the 15th percentile, and your grant ended up at the 16th percentile. Well, if they follow the rules strictly, you won't be funded. But if the program officer knows about your project, has been excited about it from the start, and can make a case, I've had 2 large grants funded that way because the program officer went to bat for our idea and did an appeal and said, even though this is maybe a percentile 2 or 3, I've seen people jump a number of percentile, up to 5, 10 percentile points. And so that's where the program officer is really important. The way to approach the program officer is often develop your AIMS page, send it to the program officer and say, I'd love to schedule a 20-minute call with you to go over my idea. And do that toward the beginning part of your application because it can help you in multiple ways and can pay dividends. And they're mostly all really helpful people. There are going to be a handful of program officers who are hard to get a hold of and aren't all that helpful. But at least in my experience with multiple agencies, foundations, federal agencies, international agencies, the program officers are in it because they want to see this work happen. And so make that person your friend and make them helpful to the work you're trying to do. And then sometimes, turn to your own institution, pilot funding, small pots of money that can lead toward a larger grant. So in the NIH world, an R03 grant, a small grant, is definitely easier to get funded than an R01 grant, but it's still not easy. And so if you can go to your institution or your department chair or your agency head and say, I need $5,000 to hire a research assistant to collect a little bit of pilot data for this study I want to do. Could you help me with that? That's often a quicker, easier way to do it. And for a lot of our teams around here, we go that route first because it's so much quicker and easier than trying to get a small gap funded. Now, if you're in an area where those resources just don't exist, then you obviously have to look toward other means. This is more for the main text, but use tables and figures effectively, rewrite, allow a lot of time, allow the most amount of time really for the Ames page, but do that for the whole grant itself. You know, to think about comparing writing a grant to writing a journal article. A journal article, if it gets rejected in the first journal, you probably have 5 or 10 other journals you can send it to, and a good journal article is always going to get published somewhere. A grant could be a little different. So if you're writing a grant to an RFA, you know, a funding opportunity, it's very specific. There are a number of funding opportunities that we work on here where you only get one shot at it. And so when you only have one try, you want to have the grant be as good as possible, not only the science of the grant, but the look of it and the grammar. You know, I can clearly see that sometimes if a grant is poorly written, a reviewer can equate poor writing. A person who's a poor writer is not a good scientist, not a solid scientist. If you can do it, have a mock review, encourage your reviewers to be as brutal as possible. Don't have them, you know, tell you how wonderful it is. Have them look for the flaws, because that's what reviewers are going to do. And then if you're a junior person, participate in a review. That can be a mock review at your own institution. The NIH has the ECR, the Early Career Reviewer portal, and so you can go on and sign up as an early career reviewer, even if you don't have NIH funding yet. And that is sort of like, if you know the movie The Wizard of Oz, it's kind of like pulling back the curtain on the wizard. It's where you learn about the process in a way that, you know, someone could tell you about the process, but till you're on it, you really don't understand it. And so I would really encourage you to do that. And also, if you know somebody who's on a study section, one of your senior colleagues, a lot of times they can request through what's called the SRO, the Scientific Review Official. I've got a great, you know, junior faculty, the Dr. So-and-so, who would love to come on and be an ad hoc reviewer in the next study section. And that's quicker. It's a quicker way to get on a review. Well, my cartoon, it's not always fair. It won't always seem fair. You know, this is the one about taking the exam. The exam is we're going to climb the tree. Obviously, the goldfish has a little bit harder time of it than the bird or the monkey. So keep that in mind. It isn't always fair, but with enough hard work, you can be Usain Bolt. And this is, you know, when someone's running so fast, they can look back at their competitors. That's a star. And so it does, with preparation, the right opportunity, hard work, writing and rewriting, and that all starts with the Ames page. You can be successful in making this happen. A couple of resources. This is the 10 tips Manola Proctor did, who's on our group, and our article we did on grant writing that's up there. Both of these are free articles. The NCI has a content analysis of funded D&I grants, and then they also now have a portfolio of cancer-related grants on their website, on their implementation science group at the NCI. And so you can look at full grants that are funded. And then the best source that we found is the one at North Carolina. They have a D&I website they call Tracks, and they've been able to go out to investigators who have been funded and ask them to provide their full application. And I don't know how many they have up there, but they have a bunch of applications, all different types, sizes, content areas. So that's the website for that portal, and it's really great. You can look through grants that have been funded to see what people did and how they set it up. And thanks to colleagues, Russ, Matt, and Kurt especially, but many others who shared their ideas. A lot of these ideas were sort of things we put down on paper, and then we've tried them out with different people to sort of see if they pass the laugh test. And I think they do. I think they're generally good tips, but you know, it's a little different for every person. And so I think that's it. So I'm going to stop talking, and Teresa, I'm going to hand it back to you guys, and we can have some Q&A.
Excellent. Well, thank you so much, Ross. This was really wonderful and encouraging. for people who are thinking about writing their first grant, or even people who have a lot of experience, how someone exposed to all that you have, the study section and all the grants that you've led, really thinks about things critically. So I had a question for you about writing for dissemination and implementation science, because that's an area that you know a lot about. I think for people who are moving from writing specific aims for more classic, sort of like randomized controlled trials, but now move into thinking about their work in implementation science. So say you're writing for a hybrid design, where by nature of a hybrid design, you're going to have elements of what you're doing that relate to effectiveness, but also relate to implementation. So you're already reducing the amount of aims you have to work with here, but maybe there's complexity within what you're trying to do implementation-wise and effectiveness-wise. What's your advice to people in writing strong implementation science-specific aims, especially for hybrid trials?
Yeah, it's a great question. In the early days, when the hybrid nomenclature first came out, I would have answered this differently. I would have answered it, you really have to explain what a hybrid design is, why you're doing one, why you can do both effectiveness. So if everyone there probably knows this, but the hybrid design is really combining an effectiveness study. So you're testing the effectiveness of an intervention as well as an implementation study. And so there's three versions of it. Hybrid 1, which is more effectiveness and less implementation, all the way over to hybrid 3, that's mostly implementation, but a little bit of effectiveness thrown in. So I think now, because there's been so much written and discussed about it, generally if it's going to a D&I study section, people will be familiar with what a hybrid design is. So you won't have to justify, oh, I'm doing a hybrid design because of X, and here's what it is. Usually you can just say, we're naming this as a hybrid 1 study, and the effectiveness part of this is X, and we're going to do a little bit of implementation work on it as well and begin to develop that. If you're going, so, you know, as you well know, Teresa, a lot of D&I grants end up not in the D&I study section at NIH. So if you're going to a study section that you think will not be familiar with this hybrid design terminology, then I think you need to explain it a little bit more and kind of go into a little bit more about it. The one tricky part is, I know a number of you do more community and public health kind of research than you do medical research. The way the hybrid design was originally written up, it really was written up for clinical research. So you have to kind of translate some of the terms back and forth. And Jeff Curran has been the one doing a lot of this work and thinking, and I know he's been working on, you know, how do hybrid designs apply to policy? How do they apply to public health problems and the kinds of things that a lot of you work on more than like a clinical trial with a randomized design. And I think the standards of, you know, what reviewers look for, whether it's an effectiveness study or an implementation study, are the same. Are these meaningful research questions? Are they using the strongest design possible for the kinds of questions they're trying to answer? Are they using adequate measures? Do they have the feasibility to recruit and retain the participants in their project? That kind of thing. I don't know. What do you think? You've had this kind of experience as well. Do you have any other thoughts?
Yeah, I think usually we do lay out sort of our, you know, depending on which hybrid design you're using, our effectiveness aim, our implementation aim. But then the question becomes, if you're doing things like cost, you know, do you slip that in? Is that a part of your implementation, or is it its own standalone aim? And we've been having a debate about this on a grant we're writing right now. I think if you're doing something really innovative methodologically on one of those dimensions, like you're doing something more advanced with your costing, that might need to be pulled out as its own aim. But also if you're maybe collecting receipt data, doing more general approaches, it could be included in what you're learning about implementation. So I'm trying to advise a colleague on this right now, and that would be my current advice. But if you have any other thoughts on where you put things like cost, I'd be interested to know.
Yeah, I think I tend to agree with you. I think if the cost is a big part of the study, say let's say you're doing an incremental cost effectiveness, obviously that's an aim in itself, and sometimes a whole study in itself. The safer way to deal with cost is we're going to collect cost data. You know, let's say we're going to collect direct cost data, and that might be a subpart of either the effectiveness arm or the implementation arm. And that's usually safer. You might still want a small part of an economist on the project, but you're not trying to do like a full-blown incremental cost effectiveness or cost benefit analysis. And I think I tend to use, it's always money is important, and costs are always very important in a study and tracking it, as well as replication and scale up. But you can get into challenges if you kind of do something that's big and you don't have the right economics in there. And I've found, this has been true on a lot of study sections, economists are like the toughest reviewers. They're really tough reviewers. And so I think if you go down that road with a lot of economics, then have a really good team and make sure it's really good, because the economists tend to be very quantitative, and at least on the D&I study section in my years on that, they tend to be some of the toughest reviewers.
Yeah, no, that's really good advice for everyone. So I want to open it up to people in the room and online.
Yeah, I had a question. I recently wrote in RO3, and as I was writing it, I really felt like there was one aim. But it looked pretty weird to have one aim. So I added a second aim, and I think that ended up hurting me. So is it, especially for a small grant like that, is it okay to have just one aim, or should you try to break it into two to make it look a little bit more like it's going to be a progression?
That's a great question. I would say people are not used to seeing a grant with one aim. But in an RO3, that might be fine. You know, what I would probably do is draft it the way you think it makes. So this is a grant that has been reviewed and has come back down. You're going to revise it. Is that right?
Exactly.
Yeah.
Because it's still a little money, but.
Yeah. And so basically you put a second aim on it, but it didn't really work that well. It didn't really make sense. Exactly. What happened.
Felt like it's
So I guess since it's gone through review now with two aims, if it goes back to the same study section, you'll probably have some of the same reviewers, probably not all of the same reviewers, and they probably will remember something about it if it goes back in fairly quickly before their memories fade. I would, now that you've gone down the road with two aims, I would probably stick with that if you feel like you can make that second aim meaningful. But I don't think it's necessarily a bad idea to only have one aim. What I would usually do with that is begin with running it by your colleagues and run it by the program officer at NIH and get their input as well. Because you can make the argument for an RO3, which is a fairly small grant that happens quickly. One aim might be perfect. And so you might have one specific aim with two parts to it, you know, something like that. And at least if I was reviewing, I wouldn't nail you for not having two aims. I would really be looking at, is this a meaningful aim and does it make sense? Because I do think, I mean, I've seen RO3 grants with 4 aims, and I look at those on the opposite way to say there's no way you're going to be able to do 4 aims with the amount of money and the amount of time you have. So I don't know if that helps, but I think probably I would stick with what you've done now if you can address the reviewer's concerns. You've got the summary comments back now? Yeah. So if you feel like you can address those concerns, then I would probably stick with it. If you feel like you can't, then I would have a bigger discussion about how do we do a more major overhaul of this. I wouldn't give up on it, though. I don't give up on grants very often. I'm pretty stubborn, and that usually works. You got to stick with it. We've entered a weird field. You all have entered a weird field. A lot of you are fairly junior. You know, this is a field where some of your best ideas won't get funded right off the bat, and some of your average ideas will get funded, and that's just part of life. And so if you've got a good idea you're passionate about that you want to see happen, stick with it, because you will eventually get it funded in one form or another. It might take you longer than you thought, but you can get it funded and it can have an impact. And so you don't want to be, you know, so stubborn that you are unrealistic, but a little bit of stubbornness is okay in this field because it isn't always logical and rational, like the cartoon said.
Thank you so much.
Yep.
Do you have any questions online?
I asked people to raise their hand if they had any questions, and I would unmute them.
And hands raised. Others in the room? Other questions? You have the expert, and maybe, you know, if you have an implementation science question that's not exactly about specific aims, you've got Ross here, so it's your chance. Ross, I was wondering if, while people are thinking of questions, if you could talk a bit about how aims differ technically. You were talking with Erica about an RO3. So how do you think about aims when you're doing a full force RO1 or something more formative? So, what is the mindset people have to adopt depending on the type of mechanism they're going after if it's more formative compared to a more definitive RO1?
Yeah, it's a good question. It's really sort of the framing. It's almost more the setup of it. So if you've got an RO1, you want to be setting it up by, here's the pilot work that we've done to set up this aim. The aims in an RO1 will tend to be more quantitative. If it's a quantitative aim, it's going to need to be powered at a certain level, whereas in an RO3 or an R21 smaller grant, they could be exploratory. At least the R21 grants, they kind of look those as sort of high risk, high reward, like, innovative ideas that, it may not work out, but if it does, it could really advance the field. Always think about in implementation science, not only the scientific questions that are being answered, but especially in a larger grant, what scientific methods will be advanced as well. So let's say that first time you're applying, making this up, but first time you're applying agent-based modeling to a certain implementation question, that will be a new application of the model. And that will not only answer questions in your field, but will show others how a system science model could be applied across a range of different implementation science. And that can be an innovation. So that can fold in as an innovation as well. But I think a lot of it is down to the scope and the complexity of the aim, depending on a big grant or a small grant.
Yeah. And we do have a question from our colleague Mary Kay online. Mary Kay, do you want to unmute so you can ask your question of Ross? Or I can ask it for her.
Yeah, that might be.
I know that this is not necessarily about specific aims, Ross, but it was about thinking about power calculations in implementation science grants, especially hybrid grants. When you have established effectiveness, say, and now you're trying to do a hybrid design where you're asking implementation questions, how do you think about power in a grant when maybe you're comparing a strategy of doing something that's already been proven effective to, so you've got one strategy being compared to another, and to truly detect effect, you'd have to have massive sample size, and it would become not very feasible and not very affordable. So the question is, how do you think about power in implementation science hybrid designs?
Yeah, well, Mary asked the hard question, which I always appreciate those. It's tricky. I think it's a lot easier in a sort of a biomedical world to answer the effectiveness part of it than the implementation part of it. What we usually do is sort of think about, okay, for this implementation study to be successful, to achieve the impact that we want, what's going to change? Is it the organizational behavior of someone working in a clinic? Is it, prescribing patterns, or is it the use of evidence-based practices by an NGO, something like that? And so, if the effect, so this sounds kind of like a hybrid 3, so effectiveness is fairly well established and you're studying more implementation, I would look at what is the primary outcome or one or two primary outcomes for the implementation part of the study. And it often is something at the uptake of evidence-based practices or organizational change. In the early phase, one might even be awareness or intention to use an evidence-based practice. The tricky part is those are often harder to measure. We often don't have a biochemical validation of those. And they also have more sort of inputs into what goes into that measurement. So we try to think, okay, what is the outcome for the implementation part of the study? What is the range of plausible values? Do you have any pilot data that will help you establish what that range might be? And then do a sensitivity analysis like an economist would, where you vary different parts of it and you come up with a power calculation. So even the most conservative estimate of rate of evidence-based change, the variability about the measure, the type 2 error that you're willing to accept, and you basically calculate power curves so that you can look at a range of plausible values. And using that sort of method, you're making, because, if you really knew what was going into a power calculation for one of these studies, you wouldn't be doing the study. You'd already know the answer. And so you're always making best estimates of the implementation size. You know, what's the outcome you want to measure, and what's the size of the effect that you might expect, and then vary it. And I will warn you, at least with my biostatistician people, it's often taken a kind of a longer educational process to get them to understand that it might not be a biochemical outcome of a study. It might be something that's affected by an implementation strategy in training, capacity building, incentives, other things that are on the long list of what an implementation strategy is, not a behavioral endpoint. So that's a little bit of thinking. It's a tricky thing. So there definitely is not a magic formula. In fact, we're having what we're calling a stats boot camp. I think in like mid-February here, and one of the guests is going to come in to talk about, you know, power analyses for D&I studies and how to calculate those. So if I get any more epiphanies after that, I'll let you know.
Yeah, I think we need a grit seminar on that for sure. And this is a real wonderful seminar. Ross, we want to thank you so much for taking the time and spreading all of your tremendous knowledge and helping inspire people with their NIH grant writing. And we're at time, so I guess I'll bring it to a close and thank you very